And with that, it's my pleasure to introduce Dr. Steve Krause of Valent Biosciences, a Sumitomo company. Steve is an entomologist by training. He brings us deep experience in the effort to eradicate dengue fever and also other contexts such as West Africa's black fly, known as the carrier of river blindness. We are so pleased to have him with us to share his views from yet another context and angle of this conversation. Please join me in welcoming Steve to the stage.
Good afternoon, and thank you for the opportunity to bring yet another variable into this equation. That the first panel was focused on lessons learned, and my brief comments will be focused on targeting the vector or the insect that actually transmits the disease. And Sumitomo Chemical and their affiliate companies have considerable experience in working with malaria and dengue fever and Zika to try and manage the populations of the vector. In some cases, the goals are extreme, to try and eradicate malaria, for example, from Africa, a goal put forward by Melinda Gates. And what we're trying to accomplish here, starting in South Miami, is to just slow the establishment and maybe slow the rate of spread of the inevitable. In New York City, I think this is an appropriate venue for this discussion. And again, on behalf of Sumitomo Chemical and everyone here, we're very pleased to be part of the discussion. Zika virus does represent really the latest threat we have in terms of vector-borne disease affecting our health. And the first cases of local transmission were found down in Wynwood neighborhood of Miami, July 29th. And on August 6th, interventions took place, and over the next 4 weeks, very active treatments were conducted. And there were 45 days of no transmission, and the governor of Florida declared that zone Zika-free, which is a very nice component to those who live within that neighborhood, especially the mothers who are either pregnant in first trimester or looking to become pregnant. That's just the start. What are we doing since, and how can we move forward? And of course, whenever you think about vector-borne disease, malaria pops into the mind of most people. And malaria over the past 100 years, which is represented on this graph, has shown a decline in annual deaths from about 3 to 3.5 million to about 500,000. And what's interesting about this is there's been about 3 separate intervention phases, first led by the use of blood treatment and DDT and similar technologies post-World War II. In the second intervention here, you saw a continuation in the slope. This is basically organized abatement, organized mosquito abatement to cause decline. And then we see, unfortunately, an upsurge in number 3. And this really was the result of donor fatigue, insecticide resistance, and environmental concerns over the use of DDT. So what's happened since 2000 in terms of malaria control is the very strong establishment of something you're all involved with, which is public-private partnerships. And public-private partnerships are really the reason for the continued decline of malaria throughout sub-Saharan Africa. And a major component of the intervention is the creation of a bed net, first created by Sumitomo Chemical and others, to protect you while you sleep from the vector that's active in the evening. This is not the case with the Zika virus vector, which is a crepuscular feeder, or one just after dawn and just before dusk. So different intervention altogether. The point of this decline, though, is that there was a number of key groups formed by President Bush with his malaria initiative in 2006, and also a group called Rollback Malaria that has been founded since 1998 and has led to really, I think, a whole host of successes based not just on vector intervention, which is my focus, but also on extension, community outreach, distribution of intervention, trust from local health officials, et cetera. So we're trying to use the model established with malaria, public-private partnerships, and bring that into other disease contexts, including dengue, onchocerciasis, and now today, Zika. So with that in mind, I just listed a couple of key examples of public-private partnerships that have shown the way to improved health. Again, maybe quite a few of you are familiar with West Nile virus here in the US. It's an ongoing threat we have. It was established here in the year 1999. But in West Africa, river blindness, which is just a hideous disease, It caused the abandonment of villages throughout West Africa, about 14 countries, transmitted by a black fly that lives in water, and it migrates to the eye and causes blindness. So working adults can't continue, children have to look out for the adults, and whole villages decline. 14 years of vector control, blood treatment with ivermectin, and education led to the elimination of risk of river blindness and recolonization of those economies and citizens. A terrific story of success. Similarly, in the middle, we have rollback malaria. Again, this is another intervention that now has over 500 partners in this public-private partnership, which is leading to just substantial, wonderful success rates for reduction. There are now 8 countries in the southern part of Africa targeted for elimination or eradication. Very exciting time. And finally, below, dengue vector program here in Southeast Asia. We partnered with a number of different groups and showed for the first time, and now it's in published literature, reducing dengue cases in people following vector intervention. It's one thing as an entomologist to reduce the number of mosquitoes transmitting a disease. It's another to link that to a decline in the disease and an improvement in health. And this is where we're at today. Wonderful examples of disease reduction in dengue that we're looking to transfer here into the United States. And I think the idea or the notion of optimism is quite high for good reason. Let's focus on the United States for just the last couple of minutes. This is a slide showing malaria back in 1870. Of course, malaria, many of you know, was rampant. Yellow fever as well. Many diseases which we don't think about were part of our ecology. Currently, though, malaria is considered more or less eliminated from the United States, primarily because an organized effort was made to bring health departments, local government entities, local citizens into what's called an association, a mosquito control association, founded over the river in New Jersey back in 1903. Now this spreads across the entire United States. These are infrastructures established basically for operational control. Surveillance, control, and public outreach is key. It was talked about earlier, the trust factor. These people are all about local trust, which is what's needed. Why is that important? Because in this particular case, we talk vector control. The other component that comes forward is insecticides. So we know what happened in Puerto Rico in August. There's a lot of concern over the consequences of pesticide application versus the risk of Zika, risk of disease. So how do you balance those two initiatives? That's where local education and local communication is so important. Now it is considered eliminated from the United States. The vectors are still here, the disease is still here, but we have the infrastructure to detect and manage risk. We, of course, have a new challenge with Zika virus. Many health officials here know far more about this than I do. It's quite a concern for many people. We're heavily involved in Brazil and throughout Latin America. We work in approximately 45 to 50 different countries on different disease components. Now we have Zika virus in southern Florida. Where it will spread, it was mentioned earlier. Pretty good idea of risk in various communities, especially urban centers. But let's talk about the successes recently in Florida. You've seen maps like this. They change every day. Last count, there's well over 70 countries with transmission in the past year and a half. And it just keeps going up. Currently down in Florida, there are 9 active case investigations. 33 cases have been closed. And local transmission, of course, I mentioned before, was found in Wynwood and Miami Beach communities as well. So there's a lot of vigilance now to detect. People are waiting for winter to kind of cool things down, but based on what we've seen here the last couple of days in New York and elsewhere, it remains quite warm and quite active in terms of vector populations. So what has the global health community done to date to address Zika? WHO has put together a response plan with 4 key pillars of action. And the one that we're most interested in from our perspective in terms of vector control is called prevention. And you'll note there's a little red box at the bottom that talks about the need to create evidence for impact. And what we're indicating in the community and in the published literature is that as we speak, more and more data is coming forward from the dengue world regarding evidence for managing caseload based on vector control. Southeast Asia examples in Malaysia and also in Cambodia. And then most recently in the bottom, the Florida Keys does a lot of work with aerial applications of biorational larvicides to try and protect all of those citizens. Most of you know without vector control, you wouldn't be able to go to Florida. Everyone recognizes that, or live along the coastline. It's very important, and that it has to be part of our discussion with Zika control. This just summarizes the data These are the literature down below. This is also a little handout we have. If you want to read the detail behind the science, it's there. So this is, again, reason for optimism that our tools we have today can be applied in the United States. This is just a picture of what is happening down in Key West. Every couple of weeks, there's an application. And I think it was mentioned earlier that just like a diet or health, it's not a silver bullet. Public health is an ongoing, boots on the ground communication effort. It takes work, but with the right tools and effort, you can make a difference, and this is what we're seeing in many different areas. Oh, just a word on the Wynwood neighborhood. You may have seen this published in the paper. This is the site of the very first local transmission. Our team's been on the ground there for quite some time. It's an urban area. It's a very eclectic community. It's a wonderful place to be, plus there's a lot of poor areas also nestled here. They conducted aerial work, groundwork, community outreach, et cetera, and with some effort, the Florida governor did declare the area Zika-free in September of 2016. What does that mean the following day or weeks later? It could change. We recognize it. But today, it's good news for those people who are very concerned with the disease. So finally, just to summarize, our studies from dengue globally indicate we have the ability today, with registered interventions and a strong AMC institution out there transferring knowledge to local citizens. And we believe that we can continue to make a difference in this evolving disease that's affecting quite a few people. So just in closing, we're trying to reduce the rate of spread where we can. We're working with modelers to identify those hotspots, those risk zones. We're an increasingly urbanized mobile community. We all recognize that. That doesn't make our job any easier. But in final thoughts, just on behalf of Sumitomo and their affiliate companies, we're very proud of the historical work we've done in the malaria world and other vector-borne programs. And we look forward to working continuously with partners and community leaders worldwide to try and manage the transmitters or vectors of these diseases. So thank you for your few minutes.